Did you know that 1 in 6 women has never experienced an orgasm? That's 15% of women missing out on a vital and fulfilling part of their sexual health and overall well-being. But here's the surprising truth. The most effective sex toy isn't what you'd expect. It's your voice. Open, honest communication about your desires, boundaries, and needs is one of the most powerful tools for transforming intimacy and deepening connections. Speaking up, without fear or hesitation, can pave the way to a richer, more satisfying experience. Sexual health is a multifaceted part of our lives, shaped by physical, emotional, and psychological factors. It's not uncommon to face challenges along the way, things like stress, hormonal changes, or even past experiences can all play a role. That's why turning to a trained therapist or sexual health expert can be a game changer. They help identify underlying causes, provide guidance, and empower individuals and couples to rediscover joy, connection, and fulfillment. Let's clear up a widespread misconception. The withdrawal method, or pulling out, may be better than no contraception at all, but it's far from reliable in preventing pregnancy. Many people don't realize that pre-ejaculate can contain sperm, making the risk of unintended pregnancy higher than expected. Understanding your options, from condoms to hormonal methods and beyond, is essential for safe and responsible intimacy. Here's another vital health fact that often goes unnoticed: the condition known as pelvic organ prolapse. This occurs when a woman's vaginal walls collapse and protrude externally due to weakened pelvic floor muscles. It's not as common as other conditions, but it's serious and deserves awareness. Strengthening pelvic muscles through exercises like Kegels can help prevent or manage this condition, highlighting the importance of regular pelvic health maintenance. Foreplay isn't just a bonus, it's essential. Think of it like warming up before a workout. Skipping it might save time, but the benefits of indulging are undeniable. Cultures like France even embrace foreplay as an art form, with oral sex being considered a natural and expected part of the experience. Perhaps this cultural approach explains why a 2008 survey revealed the French have the most sex on average, an impressive 137 times per year, far exceeding the global average. What should a couple do if they have a good reason to avoid having a child? A married couple can engage in marital intimacy during the naturally infertile times in a woman's cycle, or after childbearing years, without violating the meaning of marital intercourse in any way. This is the principle behind natural family planning, NFP. Natural methods of family planning involve fertility education that enables couples to cooperate with the body as God designed it. Why shouldn't contraception be considered part of women's preventive health care? Contraception should not be considered part of preventive health care because pregnancy is not a disease. To pose contraception as basic health care treats a woman's fertility as an unwelcome aspect of who she is as a woman. It also undermines a basic principle of real health care, which has a responsibility to affirm how a healthy body functions, always treating it with respect and reverence because it is integral to who we are. Preventive health care is meant to prevent illness, not undermine a normal, functioning reproductive system. On the contrary, use of contraceptive drugs can pose an increased risk of a range of harmful conditions, from blood clots, tumors, strokes, and some cancers, to an increased risk of contracting STDs. Is there ever a time contraceptives may be used for medical reasons? Catholic teaching does not oppose the use of hormonal medications, such as those found in chemical contraceptives, for legitimate medical purposes, provided there is no contraceptive intent. But artificial hormones typically treat only the medical symptoms. They do not correct the underlying disease or condition. They also carry the same physical health risks as hormonal contraceptives. Thankfully, with growing advancements in understanding fertility, Knowledgeable gynecologists can often prescribe non-contraceptive drugs and recommend safer and healthier treatments to correct underlying problems or eliminate discomfort. Can some methods of birth control cause abortion? Some methods of birth control are aimed at preventing the union of sperm and egg and therefore act only as contraceptives, including barriers such as condoms and diaphragms. By contrast, hormonal methods such as the pill may work in several ways. They can suppress ovulation or alter cervical mucus to prevent fertilization, and thus act contraceptively. But they may at times have other effects, such as changes to the lining of the uterus, if the contraceptive action fails and fertilization takes place. These hormonal methods may make it impossible for a newly conceived life to implant and survive. That would be a very early abortion. Medical opinions differ on whether or how often this may occur. Currently, there is no way to know precisely how these drugs work at any given time in an individual woman. Concern about the risk of causing an early abortion is stronger in the case of pills taken after intercourse to prevent pregnancy, or emergency contraception, or morning after pills. In some cases, these pills are taken when sperm and egg have already joined to create a new life, in which case the drug could not have any effect except to cause an early abortion. Do some contraceptives pose health risks? Yes. The use and availability of contraceptives is linked to the increased spread of sexually transmitted diseases. Casual sex, encouraged by widely available contraception, has resulted in about 60 million Americans being infected with one or more sexually transmitted diseases, many of them incurable and emotionally devastating. The estimated cost of treating these illnesses is now $19 billion a year in the U.S. alone. Planned Parenthood and secular sex educators recommend using condoms for protection against STDs. Yet condoms offer almost no protection against the epidemic of incurable viral STDs, such as genital herpes and human papillomavirus, HPV, strains of which cause genital warts and virtually all cases of cervical cancer. Numerous studies have found that typical condom use offers inadequate or little protection against even bacterial STDs, such as chlamydia, gonorrhea, and syphilis. Hormonal contraceptives themselves have inherent health risks. Synthetic hormones powerful enough to disrupt a woman's reproductive system may affect every major system of her body, depending on the type and strength of the hormonal contraceptive. Over 5% of women experience some of the following symptoms: headaches, weight gain, acne, mood swings, depression, anxiety, breast pain, dizziness, severe pain during menses, a range of bleeding problems, and a lack of desire for sex. In the case of Depo-Provera, there can also be a 5 to 6% loss of bone mineral density after 5 years use, which is only partially reversed in the years after discontinuation. Among the less common side effects of hormonal contraceptives are the following: blood clots in the veins, lungs, heart, and brain, potentially causing heart attack and strokes; breast cancer, potentially life-threatening ectopic pregnancy, in which the embryo most often implants in the narrow tube between the ovary and womb; liver tumors, and ovarian cysts. The link between hormonal contraceptives and breast cancer has been known for over 30 years. The World Health Organization has classified synthetic estrogen and progestin in contraceptives as carcinogenic to humans. According to a major meta-analysis, women who use oral contraceptives before age 20 have a 1.95% elevated risk of developing breast cancer. Moving on to some fascinating facts about male sexual health. Did you know that regular erections are essential for penile health? Without them, the tissues can lose elasticity, leading to shrinkage of 1 to 2 centimeters over time. Fortunately, your body has a built-in penile maintenance system, nocturnal erections during REM sleep. Whether you're dreaming of tropical beaches or fending off a zombie apocalypse, these involuntary responses are vital for maintaining overall health. Let's also settle the long-debated grower versus shower phenomenon. Contrary to popular belief, studies show no consistent relationship between the size of a flaccid penis and its erect length. Some men experience substantial growth, while others remain nearly the same. It's a reminder that assumptions based on appearances rarely tell the full story. Age does bring changes, but not all of them are negative. Sensitivity tends to decline gradually after age 25, with more noticeable changes occurring around 65. However, a healthy lifestyle, regular exercise, and staying informed can make a world of difference. Knowledge truly is power when it comes to maintaining sexual health and vitality as we age. Vibrators aren't just for women. These versatile tools can also benefit men, particularly those experiencing delayed ejaculation, reduced sensitivity, or nerve damage. In fact, vibrators are sometimes used as medical devices, demonstrating their effectiveness in enhancing intimacy and addressing specific health concerns. And now, for some fun and surprising trivia. Did you know the record for the farthest ejaculation is an astonishing 18.7 feet? While that might leave you amazed, animals have their own fascinating behaviors. For instance, female penguins have been observed exchanging pebbles with males in what researchers liken to a form of prostitution to secure materials for their nests. Lastly, consider this mind-blowing statistic. The Earth's entire population could be replenished using the sperm that fits inside an aspirin capsule. It's a testament to the incredible efficiency of human reproduction and a reminder of the marvels of our biology. Sexual health is more than just a taboo topic. It's an essential part of life, brimming with fascinating facts, powerful insights, and opportunities for growth. The more we explore, understand, and embrace it, the more fulfilling and connected our lives become. Stay curious, stay informed, and remember, knowledge isn't just power, it's pleasure too.